Today we are going to introduce the pharmacology, its main and subdivisions and other aspects. So what is pharmacology? The word pharmacology has been derived from the two Greek words pharmakon, which means drug, and logos means to study. So pharmacology is the scientific study of the drug that interact with the living system through biochemical processes. So first thing first, what is drug? Drug is used in two senses. The first one is pharmaceutical drugs or medicine or medicament. The second term is addictive substances, illicit substances or abused substances. So pharmaceutical drug is any chemical substance that is present in the medicine. When it is administered, it alters the body function at molecular level, and it is used for the treatment, diagnosis and prevention of diseases. Pharmacology has been divided into two main divisions. The first one is pharmacokinetic. The word kinetic, from the kinesis, it means movement. So pharmacokinetic, this describes the movement of the drug into the body, within the body and outside of the body. And this pharmacokinetic processes can be described by the acronym ADME: absorption, distribution, metabolism and excretion. Some authority use the term biodisposition or simply disposition to denote drug distribution, metabolism and excretion. Metabolism and excretion, they are also termed as drug clearance or drug elimination. So what is absorption? Absorption describes how the drug moves from the site of administration into the bloodstream. For example, we are taking the example of solid dosage form, that is tablet or capsule. When it is administered, then this drug travels from the site of administration into the bloodstream, and when this drug reaches the blood, then this drug is absorbed unless it is directly injected through IV route. So this movement of the drug from the site of administration into the bloodstream is called drug absorption. And distribution, this describes the reversible transfer of the drug from the blood compartment into the tissue compartment. For example, drug travels to the lungs, adipose tissue, brain and to the site of action. And metabolism describes how the parent drug is chemically broken down with the help of enzymes into the daughter metabolite. So this occurs mainly in the liver. There is a huge family, a super family of the enzyme that is present in the liver. It is called cytochrome P450 system. And this family of the enzyme is responsible for the conversion of the drug into its metabolite. And excretion, actually it is described the removal of the drug, the irreversible loss of the drug from the body to the outside. So collectively, these pharmacokinetic process, this describe the overall behavior of the drug or the overall movement of the drug into the body, within the body, and outside of the body. And now, actually, pharmacokinetic study involves taking the blood sample from the study participant over a period of different time, and this complete behavior of the drug in the body is represented graphically by taking the plasma concentration of the drug on the y-axis and the time on the x-axis. It is measured over a period of different time, and the complete behavior of the drug is graphically represented, and this gives us the pharmacokinetic study also describe the relationship of the ADME with the drug onset and drug total duration and drug total intensity. Dynamic means power. So it is the power of the drug or what the drug does to the body, or more broadly, it is the molecular, biochemical and physiological action of the drug. For example, during distribution, the drug reaches to the site of action, and when this drug interacts with the molecule or macromolecule, that is receptor, or when the drug reaches to the site of action, actually there are, with a few exceptions, the drug binds with 4 sites of action. The first one is receptor, number 2 ion channel, and carrier protein or transporter. The fourth one is enzyme. For example, when the drug binds with its receptor, that is epinephrine, the drug, when it interacts with this molecule, then this molecular interaction is specifically called molecular pharmacology. And when this drug binds with its receptor, then it activates enzyme embedded in the cell membrane, that is adenylyl cyclase. And this adenylyl cyclase convert ATP into cyclic AMP, and this further increases the activation of protein kinases, which further increases the calcium influx into the cell. So what will be the response of the drug? The response of the drug here, taking the example of myocardial cell, it is the cardiac stimulation, or glycogenolysis due to the activation of phosphorylase enzyme. So this response of the drug is discussed in the pharmacodynamic. So it is the pharmacodynamic study, and this response of the drug is graphically represented from the dose response curve. by taking the response of the drug on the y-axis and the dose or concentration on the x-axis. So this pharmaco based on the study from the experimental animal cell study or in vivo or in vitro study, the response of the drug can be measured and it gives a very good parameter, the effective dose, toxic dose, and drug potency and drug efficacy can be obtained from this pharmacodynamic study. The clinical pharmacology. Clinical pharmacology is actually the study of the drug substances that interact with the human system. Pharmacology was the interaction of the drug substances with the living thing that includes animal, including a human and microorganism. So clinical pharmacology actually it is the study of the pharmacokinetic and dynamic parameter that we obtained from this plasma concentration versus time curve and the dose response curve. Different parameters are obtained. Cmax, the maximum concentration of the drug during at this time, and also the minimum effective concentration and minimum toxic concentration of the drug. So different parameters are studied in human, and the aim of the clinical pharmacology is to evaluate data about the drug safety and drug efficacy for the optimum use of the drug in the human population. And the next discipline is pharmacotherapeutics. Pharmacotherapeutics is actually the goal of the pharmacodynamic, and it is actually the clinical purpose of giving the drug. Why do doctors prescribe the drug? To treat the patient. So pharmacotherapeutic, it focuses on selection of the most appropriate drug to the patient, specifically taking into account the clinical features of a particular patient. And the next discipline is the toxicology. It is the toxic effect of the drug and also the toxic effect of the poisonous substances, poisonous chemicals. The chemicals may be industrial, agricultural, or even household. So the study of the different toxicokinetic and toxicodynamic parameter of the chemical substance or the poisonous substance, and it also toxicology also include the study of the detection, prevention, and treatment of the poisoning. And even the same substance, the drug which is used for the treatment as a remedy, it can be act as a poison. It can act as a poison depending upon the dose. And this is what we are discussing in posology. The posology from the word posos means how much. Posology discusses about the study of the dose of the drug. And what is the dose? Dose is the amount of the drug that we take or that you give to the patient, and it is expressed by weight 250 mg or 500 mg, and also by volume 5 ml and 10 ml. Sometimes the dose and the dosage are interchangeably used, but these are not the same thing. Actually, dosage is the dose plus when and how often to take. For example, if the doctor prescribe you 500 mg to be taken 3 times a day, so this frequency of taking describe the dosage of the drug. And the next discipline is pharmacognosy. Pharmacognosy, from the cognition or from the nose, it means understanding or knowledge. So originally it was the field of the studying of the drug substances in crude form, in unprepared form, or in unrefined form. But being the branch of pharmacology, it is the study of the drug substances specifically obtained from the plant and animals, or it is the identification, the study of identification of the drug substances obtained from the plant and animal. Many hundreds of substances are obtained from the plant. For example, morphine, it is used as an analgesic, and it is obtained from the opium or poppy plant. Similarly, atropine, an anticholinergic drug, it is obtained from Atropa belladonna. So this is also a plant product. And digoxin, which is used in cardiac failure or in arrhythmia, atrial fibrillation, so it is also obtained from the digitalis or foxglove. Or similarly, some animal product, different insulins and other drug substances like thyroid hormone. And third, different sex hormones are obtained from the animals, also including the vitamin A and D from the cod liver oil. So it is the study of the drug substances obtained from plant or animal source. And the next discipline is chemotherapy. Chemotherapy is actually the drug treatment, denoting two types of substances. The first one is the chemo. Chemo means chemotherapeutic agent which are used for the cancerous cell, or in other words, the fast growing cells, due to the uncontrollable replication of their DNA. So it is the DNA damaging agent which are used to treat the cancerous cell. Similarly, the other chemotherapeutic antimicrobial drugs, and this denote the drug used to kill or suppress the growth of microorganisms. These include antibacterial drug or antibiotics, antivirals, antifungals, and antiprotozoal, and also antihelminthics. So pharmacology, the interdiscipline, pharmacology is often described as a bridge science. Bridge science, it incorporates the knowledge and expertise from different basic medical science, just like physiology, biochemistry, and cell biology or structural biology, to provide advancement which is beyond the scope of one scientific discipline. So interdiscipline is the study of the integrating different discipline. Inter mean between or among, and discipline here, it means the field of study, the field of specialization. So there are different interdiscipline of the pharmacology, and they are pharmacogenetic and pharmacogenomic. These both are sometimes used interchangeably, but the difference is that in pharmacogenetic we focus on the variation in the single genes that affect individuals' response to drug. For example, it is the genetic material of an individual, and everyone knows that genes that we have inherited from our parents are unique to us alone. Just like the gene decide the color of our eyes and the gene also decide that how our body metabolize the drug. Similarly, the genes in pharmacogenetic and genomic, we study the variation in the genes that codes for different enzyme that metabolizes the drug. When there is a mutation in these genes, then these genes affect this individual's response to drug. For example, I am taking here the example of one metabolizing enzyme, cytochrome P450, P450 2C19, and different variants of this enzyme have been developed, have been clinically studied, that this enzyme is actually responsible for metabolism of different drugs. For example, proton pump inhibitor and citalopram and diazepam. Here, omeprazole being a proton pump inhibitor, it is metabolized by the enzyme cytochrome P450 2C19, but there is a genetic variation 2C19 asterisk 2 or asterisk 3. When in some individual this enzyme, this phenotype is expressed, then this individual are poor metabolizer. These are poor metabolizer and they are not able to metabolize this drug into inactive metabolite, that is 5-hydroxome prazole. So it means that in this individual there is a chances of greater plasma concentration of the omeprazole, and this individual can get a good therapeutic benefit. There is a good acid suppression. Instead of the other individual which has a variation in this enzyme asterisk cytochrome P452C19 asterisk 17. These individual having the phenotype for this enzyme, they are rapid metabolizer. They will rapidly metabolize this drug into inactive. These are inactive metabolite. So it means that in this individual here, this individual, there will be a chances of therapeutic failure. This drug will not treat this particular patient, and also this patient will get much benefit from the omeprazole. So in pharmacogenetic, when a single gene affects individual's response to drug, and pharmacogenomic, when we are studying the response of the multiple genes to the drug. So pharmacogenomic is actually, it focuses on the future of the pharmacology, and it also focuses, different scientists are working in this area to develop the more personalized drug that suit the genetic makeup of an individual. Although it raises many questions that whether the doctor would be able to treat the patient knowing his or her genetic profile. So because now or from the past 40 to 50 years, doctors are prescribing medicine without having this knowledge. So it reflects the future of the prescribing pattern. And pharmacoeconomic is actually, it focuses on the cost of the drug versus the benefit of the drug. And pharmacoeconomic method involves, just like this is the cost of the drug and this is the total prescription or the total drug treatment. So this method, pharmacoeconomics, it helps the doctor, pharmacist and other patient health care provider to make a good decision about the selection of the drug, and the drug which is most cost effective should be given priorities. And it also focuses on the total cost incurred upon the disease, whether direct cost or indirect cost. So the next interdiscipline is pharmacoepidemiology. Epi means among. Epi means among, and demos people. So it is the study of, and this discipline is from clinical pharmacology and pharmaco or epidemiology. So this combines the knowledge of the clinical pharmacology and epidemiology, different research and different method to study the drug in large number of population. Actually, pharmacoepidemiologist uses different research method, just like case control study, and number 2, cohort study, and number 3, clinical trials. When the drug are tested upon the human, clinical trials, different clinical trials, and scientists or pharmacoepidemiologists using this pattern of the study methodology, they observe the study of the drug in the large number of population to get the most effective, or to get the knowledge about the drugs effectiveness and drug adverse reaction in the number of population. And another discipline is pharmacovigilance. Pharmacovigilance, the word vigilance here, it means to keep watching. So pharmacovigilance is actually the post-marketing phase of the drug. When the drug is marketed and when it is launched, then still the drug is not left at ease. And the pharmacovigilance is the study of the reporting of the adverse effect of the drug is called pharmacovigilance. Giving you the example, taking you back to the history, that in 1957 till 1962, one drug was launched in the West Germany, and this drug was called thalidomide. Then it was not tested on the human. What happens that this drug was known to have an anxiolytic effect. It was used as a sleeping pill, and soon this drug became an OTC drug, and even it was given to the pregnant mother, known for treating the morning sickness, nausea and vomiting in the pregnant mother. Then what happened in 1962, the 10,000 report says that 10,000 children were born but without their arms, without their legs. And this condition was, these 10,000 people were with a medical problem termed as phocomelia, and that children they have deformed eyes, they had deformed GIT, and even they didn't have the arms and legs or the forelimbs. So after this tragedy, this was a thalidomide tragedy or disaster caused by this drug, and then the United States FDA and different regulatory authorities came into action that every drug must go through all the clinical trial phases before being marketed, before being launched. So this was the complete story. And adverse effect of the drug there is a difference between the adverse effect and side effect. Sometimes people get confused in this. Side effect, when you are expecting from the drug that it has this known effect. For example, from the anti-allergic drug, we can expect the drowsiness. And similarly, from the codeine, we can expect, and it is this side effect is already documented or predictable, that is constipation. And it may be harmful, and even it may be good. How? For example, minoxidil was initially developed to treat hypertension, but its unwanted side effect was excess hair growth. And now minoxidil is formulated in a different formulation in a lotion and cream and spray form to treat the baldness. So the side effect may be good and may be bad, but the adverse effect is always harmful. Just like I told you the story of the thalidomide tragedy, and the adverse effect has not been studied in the clinical trial, so therefore it is not documented. And therefore pharmacovigilance plays a great role. And because in a different country, national pharmacovigilance center are established under the Ministry of Health. Chronopharmacology, the word chrono, it means time. So this chronopharmacology focuses on the chronotherapy to treat the patient at the right time, or more broadly, it gets the knowledge from the chronopathological condition and chronobiological events. For example, certain disease condition becomes worse in the morning, and some disease condition becomes worse at night. And clinically, studies have shown that asthma attack is increased at night, and also the cholesterol synthesis also occurs, it is intensified at night. So the drug used for the asthma or cholesterol will work best when they are given at night. And another example is rheumatoid arthritis. And rheumatoid arthritis, the different inflammatory substances and pain, it peaks in the morning. So the best time for treating the rheumatoid arthritis are giving anti-inflammatory drugs or painkiller ibuprofen. It will work best in the morning. So these were all the big picture of the introduction of the pharmacology.